Welcome back to Medicare Tales and Marshmallows, the only place where Medicare gaps are patched with conversation and chocolate-covered marshmallows. If you've only got original Medicare, Parts A and B, you think you have a solid foundation until you get the bill and realize the foundation come with holes. Enter today's topic, Medigap. It's not a Pokemon, though I have seen people stare at their enrollment forms like they're waiting for it to evolve. Dr. Connie Aldridge is here again with her blazing wit and bottomless file cabinet of wisdom. Doctor, welcome back to the fire ring.
Glad to be here, Kem. I brought the marshmallows and my G plan versus N plan cheat sheet. It's laminated, like all good regrets.
But of course. Okay, let's jump right in. What is Medigap?
Medigap, also called Medicare Supplement Insurance, is private insurance that helps pay the gaps in original Medicare. You still have Parts A and B, but Medigap covers the costs Medicare doesn't pay, namely deductibles, coinsurance, and copayments.
So it's like Medicare's roommate who chips in for rent.
Exactly. A good roommate who pays on time, doesn't eat your leftovers, and occasionally saves you from a 5-figure hospital bill.
And this is not Medicare Advantage.
Correct. That's where people get tripped up. With Medigap, you stay on original Medicare. Medicare pays first, then Medigap pays its share. With Medicare Advantage, your care is bundled in a private plan that replaces Parts A and B.
Got it, I think. So with Medigap, I can go to any provider who accepts Medicare.
Bingo. No networks, no referrals. You're free to roam like a backpacker in the Alps, if the Alps had outpatient clinics.
And what are these plans? G, N, F? Sounds like a school report card.
Each lettered plan offers a different level of coverage, and there are many more letters, but these 3 are the most well-known. Plan F used to be king, but it's now closed to new folks who became eligible after 2020. So it's more of a collector's item now.
Okay, let's really dive into the alphabet salad that is Medigap plans. Plan A, B, D, G, K, L, M, N, like Medicare had a Scrabble bag and just went for it.
Kem, the alphabet soup was lukewarm when it started, and now it's boiling over.
Riddle me this. Why on earth does Medigap have so many plan letters?
Oh, honey, because Congress doesn't know how to say simple. Back in the day, Medigap policies were like the Wild West. Every insurance company made up their own versions. Super Silver Plan, Gold Plus Deluxe, Plan Y but with Z. Total chaos. People had no idea what they were buying. So, in 1990, the feds stepped in and said, enough, standardize it. They assigned letters to the benefits packages and made every insurer offer the same version of each plan. So Plan G in Georgia looks just like Plan G in Oregon.
So the letters are like uniform models. Got it. You mentioned Plan F as a thing of the past earlier. Any others discontinued?
Ah, yes. There's also Plan C. I call them the ghost plans. Plans C and F were the only ones that covered the Part B deductible. Congress decided that was making things too easy, so they passed a law to eliminate them.
So no more full ride?
Nope, only for those that already had them. They wanted beneficiaries to have a little skin in the game. You know, because people getting joint replacements were obviously just doing it for fun.
So Plan G is the new gold standard.
It's definitely one of the more popular plans. Plan G covers everything except that pesky Part B deductible.
Okay, got it. G is the GOAT until it's not. And Plan N?
Plan N is also quite popular, but a little quirky. You pay copays for doctor visits and ER trips, And you can get surprise bills if a doctor charges over the Medicare limit.
So basically, you save now, but you may pay later.
Something like that. And then you have other less popular letters like you mentioned earlier. Think of them like a discount menu of sorts. These plans come with lower premiums but higher cost sharing. So, for example, with Plan K, you pay half the cost of services, but the monthly premium is much cheaper. They even throw in out-of-pocket limits, too.
I have to admit, this is all mind-numbing. Why not just have less plans and name them something normal, like basic, classic, premium, deluxe with bacon?
Too funny.
So we're stuck with the alphabet soup.
Until someone passes a law to rebrand them, yes. And knowing Congress, they'll just switch to Greek letters, and we'll all be explaining the difference between Plan Delta and Plan Zeta on TikTok.
Please, dear God, no. Okay, so once you wade through all that and choose a letter, are premiums basically the same across the nation?
Not even close. Medicare supplement plans are sold by private insurers, so the coverage is standardized, but the price varies wildly based on where you live, your age, whether you use tobacco, and whether the company uses community, issue age, or attained age rating, which sounds like 3 different ways to ruin your birthday party. Frankly, my advice is to work with a trusted agent, state ship resources, and shop around. Ask a lot of questions before selecting a plan.
Let's talk enrollment. When should people enroll in a Medicare supplement plan?
Your best window is your Medicare Supplement Open Enrollment period. That's 6 months from the first day of the month you're 65 or older and enrolled in Part B. During that time, you have guaranteed issue rights, meaning you can't be turned down or charged more for pre-existing conditions.
And after that?
It's like musical chairs. You can still apply, but in most states, the insurance company can say no, charge you more, or exclude coverage for pre-existing conditions. That's why people who miss that window often end up stuck or paying more.
Any common misconceptions?
Oh, plenty. Let's see. It covers dental. Nope. It includes prescriptions. Nope again. Medigap doesn't include Part D. You'll need a standalone drug plan. It covers long-term care. No chance. So it's a cost gap filler, not a coverage genie. Precisely. It does not add benefits to Medicare coverage, only helps to cover the costs that Medicare Original doesn't pay. And it only works if you stay on Original Medicare. If you switch to Medicare Advantage, your Medigap plan goes on the shelf, and you may not get it back later without underwriting.
So remind us again, please. I think it's important and bears repeating. When can folks sign up for this without going through underwriting?
Sure. One more time with feeling. You typically need to enroll during your Medicare Supplement Open Enrollment period, 6 months after you're 65 or older and enrolled in Part B.
And people sometimes don't realize this until their 6 months window has passed, right?
Yep. And then they try and sign up years later saying, I didn't know I needed that then, and now I really need it.
Right.
It's hard because at that point, depending on your state laws, you may be denied or charged more based on your health. Some states do have guaranteed issue rights or other rules that allow for more flexible enrollment options, but those are few and far between.
Sounds like one of those know before you go situations.
Or, as I often say, Medigap is like camping gear. You don't want to realize you need it when you're already lost in the woods in the dark and it's raining hailstones the size of pickleballs.
Now that's the stuff nightmares are made of for sure. Still, so many letters to choose from. I have to tell you, this all sounds daunting for us average folks.
Trust me, it's daunting for us all. But to sum it up in the most simplistic terms, Medigap plans all carry a fixed premium. The lower the premium, the higher your ongoing variable cost share, like copays, deductibles, coinsurance, will be.
And the higher the fixed premium, the lower the cost share.
Exactly. You got it, Kem.
Dr. Connie, you are, as always, a national treasure and a policy whisperer.
I'll take that as long as I don't have to explain the alphabet soup plans ever again.
No worries, we're recording this for posterity. Thanks, Dr. Connie. Well, there you have it, folks. That's all we have for you today. Until next time, folks, stay warm and marshmallowy.